The anatomy of the prostate is relatively simple. The prostate is a small gland located between the base of urinary bladder and the rectum. Encased in a fibrous capsule, the prostate has a base that lies against the bladder neck above and apex that lies against the urogenital diaphragm below. The two ejaculatory ducts pierce the upper part of the posterior surface of the prostate and open into the prostatic urethra at the lateral margins of the prostatic urticle. The prostate is filled with glands set in a combination of smooth muscle and connective tissue. Those glands release their contents in the urethra. The prostate is divided into 5 lobes. The anterior lobe lies in front of the urethra and lacks glandular tissue. The median or middle lobe is the wedge of glands situated between the urethra and the ejaculatory ducts. Its upper surface is related to the trigone of the bladder. It is rich in glands. The posterior lobe is situated behind the urethra and below the ejaculatory ducts and contains glandular tissue. The right and left lateral lobes lie on either side of the urethra and are separated from one another by a shallow vertical groove on the posterior surface of the prostate. Those lobes also contain many glands. Clinically, it is essential to know that middle or median lobe is prone to benign prostatic hypertrophy, and the posterior lobe is prone to prostatic carcinoma. The prostate is related superiorly to the base of the prostate, which is continuous with the neck of the bladder, with smooth muscle passing without interrupting from one organ to the other. The urethra enters the center of the base of the prostate. Inferiorly to the apex of the prostate, which lies on the upper surface of the urogenital diaphragm, the urethra leaves the prostate just above the apex on the anterior surface. Anteriorly to the symphysis pubis, separated from it by the extraperitoneal fat in the retropubic space, cave of Rhesus. The prostate is connected to the posterior aspect of the pubic bones by the fascia puboprostatic ligaments. Posteriorly to the anterior surface of the rectal ampulla, and it's separated from it by the rectovesical septum, fascia of Denon-Villers. This septum forms in fetal life by the fusion of the walls of the lower end of the retrovesical pouch of peritoneum, which originally extended down to the perineal body. Laterally to the anterior fibers of the levator ani, as they run posteriorly from the pubis. The prostatic urethra about 1.25 inch or 3 cm long, and begins at the neck of the bladder. It passes through the prostate from the base to the apex, where it becomes continuous with the membranous part of the urethra. The prostatic urethra is the widest and most dilatable portion of the entire urethra. A longitudinal ridge called the urethral crest is located on the posterior wall. A groove known as the prostatic sinus runs along each side of the crest where the prostatic glands open. A small depression, the prostatic urticle, an analog of the uterus and vagina in females, lies on the summit of the urethral crest. The openings of the 2 ejaculatory ducts are located on each edge of mouth of the urticle. A prostate produces a thin, milky fluid containing citric acid and acid phosphatase that is added to the seminal fluid at the time of ejaculation. The smooth muscle, which surrounds the glands, squeezes the secretion into the prostatic urethra. The prostatic secretion is alkaline and helps neutralize the acidity in the vagina. The prostate is supplied by branches of the inferior vesical and middle rectal arteries, each a branch of internal iliac artery. The veins from the prostatic venous plexus, which lies outside the capsule of the prostate, the prostatic plexus receives the deep dorsal vein of the penis and numerous vesical veins, and drains into the internal iliac veins. The lymph drains to the internal iliac nodes. Branches of inferior hypogastric plexus innervate the prostate. The sympathetic nerves stimulate the smooth muscle of the prostate during ejaculation.